Now I am going to discuss with patient has cancer, and this patient not for resuscitation. He has cancer and metastasis, and the decision this patient is not for resuscitate. After I explain to his family what is meaning by cancer and metastasis, and will start for him palliative care, already I will explain. Then I will go to for CPR. I will ask the family, after I explained to you the cause of your father's illness and the consequence of his disease, what do you think about the outlook of your father's condition? Yes, doctor. I feel that this primary disease affects a lot of organs, and there is a lot of things has been affected in his body. Yes, Mr. Hassan. Could you tell me if your father have any advanced directive or living will? No, he doesn't have. If your father has any expression or wishes about his illness when he in such situation? No, doctor, he doesn't express for me anything about that. Did your father appointed anyone to take a decision on behalf of him when he in such situation? No, doctor, he didn't appointed anyone. Let to tell you, Mr. Hassan, and I am sorry to tell you that your father has a cancer, as I told you, and this cancer not only in his liver, but it's spread outside the liver. It's now in the bones and in the bones and his lung. So that the team looking after him took a decision. Your father, it is not for resuscitation. Do you know what's meaning by resuscitation? No, doctor. What's meaning by resuscitation? Let me first to explain. Any treatment we provide for the patient is to maintain and prolong his life. And prolong his life, it will give a benefit for patient more than the risk. The aim of any treatment. But if we found any treatment will provide for the patient a lot of risk and no benefit, we will not give the patient this medication. This is our aim in the treatment and our aim in medicine. Secondly, I am going what meaning by resuscitation. Resuscitation is when the heart or the lung is stopped for any patient. We will start for him chest compression, and maybe need to put a tube to assist his ventilation in the both lung, and may also to give electrical shock for the heart, or give medication through a needle. This is resuscitation. But in some cases we found this resuscitation is not helpful and there is a lot of risk for it. So that if we outweigh the benefit and the risk of this resuscitation for your father, I am sorry to say that the resuscitation is not helpful for your father at all, because resuscitation maybe will prolong your father's life for some times, but there is a lot of risk, and your father maybe he will pass away in undignified manner. There is a lot of complications related to this resuscitation. One of these complications, as we provide chest compression for your father, he may develop brief fractures, this bone in the chest, and maybe develop some air around the lung, and maybe this collection of air will need also to insert a tube in the lung. Sometimes there is resuscitation may be prolonged, and so that the oxygen to the brain will be decreased and maybe develop irreversible brain damage. Maybe there is some injuries related to other organ like liver and spleen. So that if I outweigh this complication that may be happen to your father and the benefit of the resuscitation, we found that the resuscitation is futile. I am sorry to say that. What do you think, Mr. Hassan, about this? So that you have to explain to the patient first what is the aim of our treatment, what is meaning by resuscitation, and what is the complication of resuscitation, and why we will not consider resuscitation for his father. Before this, you have to ask about advanced directive, living will, patient wishes, and the last power attorney, and we told a lot about that in the lecture of Mental Capacity Act. This is the issue of don't attempt resuscitation. Who is responsible to make a decision this patient is not for CPR? The responsibility to make CPR to senior clinician or other member of the staff that on the charge on behalf of him. This decision should be based on clinical assessment and the patient circumstances. Sometimes, maybe the team looking after for patient take a decision this patient is not for resuscitation. But after revising that, we found that this patient may be need for resuscitation. So that the order for resuscitation is not for life. It could be revised again and could be updated if we feel the resuscitation will be helpful for the patient. There is a rule. This rule we have to put in our mind, and it will solve a lot of ethical dilemma in your brain. This rule said that neither patient nor their relative can demand CPR or any other treatment when the clinical team believes that CPR will not be successful. We have to explain to the patient or family in sensitive way and why CPR is not successful. So that if the family member of the patient told you that, doctor, I need to do for my father resuscitation, so that you have to explain why this resuscitation is not successful, why this resuscitation is futile, what is the complication could happen to your father. Even your father has a success in CPR, he will not take more than 1 or 2 days, and this his heart will stop again. The patient family has the right to take second opinion. We have to clarify this information. If the patient doctor, if the team looking after for the patient doesn't agree with the family wishes for CPR, like the family refuse the decision of not for resuscitation, the family not agree about the decision the patient is not for resuscitation, and the team looking after for the patient is take a decision this patient is not for resuscitation, so that we can take second opinion. If still there is disagreement, we have to go to legal advice may be required. Again, if there is any confrontation between you and the family, you have to make a second opinion, or you can say, I will arrange a meeting with my consultant. If the examiner asked you if still disagreement between your consultant and the family, we can take a second opinion. If still disagreement, we will go to legal advice.